The traditional clinical examination is a very valuable tool. More mistakes are often made by not looking than by not knowing. It's important to be systematic and to always use the same routine. The clinical examination begins with the distant examination, inspection from a distance. We observe the cow, we watch a breathing pattern. We can take a respiratory rate by counting the number of breaths in 15 seconds. Watch the respiratory pattern and any respiratory distress. We can watch any abnormal behaviour before she's distracted or disturbed. Does she lick at the fences, walk in circles, kick at her abdomen? We can also take note of her abdominal profile, look for any swellings. It's important to do all these steps before moving her into a position of restraint. Do all this before the cow's disturbed or distracted. Then we can move the cow into restraint and start the close physical examination. Once the cow's been moved into a position of restraint, like this head bail, we can begin the close physical examination. We always try to be systematic and use the same routine. We use a 5-station approach, the first station being the tail end of the cow. So station 1. Just reach out to the cow and let her know you're here, in case she's not aware of your presence. And begin with the first step, collecting urine. Take a bottle and stroke the perineum just below the level of the vulva. Try gentle, try vigorously. Now this cow's just urinated, so we're unlikely to be able to get a sample. But we persist for 20 seconds or so, trying to get a urine sample. Once collected, we look at the colour, put it aside for later, where we'll measure things like the ketones or the pH of the urine. The important thing to remember when collecting the urine is that you don't hold the tail away with your other hand. Assistants often try to help by holding the tail aside, but that distracts the cow and interferes with her willingness to urinate. The next step is checking the temperature. So with your thermometer, a little bit of lubricant helps. Insert the thermometer into the rectum, but the important thing is to remember is to push it in quite deeply and then turn it sideways against the wall of the rectum, so you're actually measuring the ambient temperature of the cow rather than the temperature of a ball of faeces inside the rectum. Then we'll look inside the vulva for the colour of the mucous membranes and any lesions in the vulva. A healthy cow has a nice pink mucous membranes inside the vagina, inside the vulva. Then measure the pulse. Don't forget your watch or a timer. Take the balls of your fingers underneath the tail, the ventral midline, just below the level of the vulva, between the joints of the tail, and then lift the tail until you can feel a pulse underneath your fingers. Once you've detected a pulse, measure the number of beats in 15 seconds. Always measure. While we're here, we should take note of the respiratory rate and pattern if we haven't already done that, and measure the respiratory rate. The number of breaths in 15 seconds, and we can multiply that by 4 to get the number in 1 minute. Then the body condition over the back, but take particular note between the tail head and the pin bones. How filled in is this area here with fat cover? We also look at the abdominal profile, looking from behind. We see if there's any distensions of the right or the left abdomen. And then finally, take note of the skin, have a feel, any roughness, evidence of insect bites or photosensitization. That completes station 1. We now move to station 2, the left side of the cow. We'll begin by examining the superficial lymph nodes, the prefemoral lymph node, just in front of the femur, below the tubercocci, underneath the skin. Roll the lymph node underneath your fingers. And the prescapular lymph nodes in front of the shoulder. Push in deep in front of the shoulder blade and run your fingers forward and let the prescapular lymph node roll underneath your fingers. Examine the left jugular vein. Normally it would be collapsed. Sometimes you'll see a pulse extending about halfway up the neck. In pathology, the jugular vein will be engorged, indicating some problems with the right side return of blood to the heart. We then move on to the auscultation of the heart. First, let the cow know that you're going to examine deep down here so she doesn't get a fright. Take the stethoscope head between your fingers and push the stethoscope head deep into the axilla between the elbow and the shoulder. Listen for the intensity of the sounds, the rhythm of the sounds, and for any abnormal sounds, and measure the rate. Count for 15 seconds, then multiply by 4 to get the heart rate in 1 minute. Always measure. Then, auscultate the lungs. In the lungs, we listen over a triangular field outlined by a straight line from the point of the elbow to the withers, just below the vertebrae, back to the second last rib, and then a straight line over the rib cage. Listen in a 3-2-1 pattern, 3 times dorsally. Listen long enough to hear the sounds. Then twice in the midfield, but pay particular attention when listening ventrally, because with bronchopneumonia, that's where abnormal sounds will begin and be most intense. Listen for wheezes or crackles or absence of sounds. When listening to the lungs, it's very important to try and remove all external noise. Ask your assistants to stop talking, stop banging gates, mustering cattle, or for machinery to be quietened. We then move to the left abdomen. With the left abdomen, there are 6 things to do, always 6 steps. The first 3, look, feel, listen. Step 1, look. Look at the left paralumbar fossa for how full it is, indication of whether the cow's been eating well or not. Feel. Dorsally in the rumen there's a gas cap that you can feel on top, then a solid rumen mat, and then fluid underneath. Always feel the contents. Listen, auscultate. Auscultate carefully for 2 minutes, listening for ruminal contractions. Measure the time over 2 minutes. Count the number of contractions in 2 minutes. 0, 1, 2, 3 or 4 or more. But even more importantly, the interval between the contractions. 30 seconds, 40 seconds, 45 seconds. And as you're listening, watch, because when there's a contraction, the stethoscope head will be pushed out with the contraction. Very important. Step 4 of the abdomen, auscultate and percuss over the left rib cage. Place the stethoscope head over one rib and percuss the adjacent rib, clicking with your fingers or tapping with your fingers over on a rib, loud enough to be heard. Always auscultate and percuss ventrally, moving back over the rib cage. If perchance you hear a ping, determine where the ping is heard loudest and then outline the ping by percussing even back to here. That will give an indication of the size of the gas cap in the viscus beneath. Then, ballot on the left abdomen with the closed fist, punch in and wait for something to bounce back, something solid. Maybe a fetus, maybe something abnormal. Always be careful, ready for a kick. Step 6, succussion. Ballot the left abdomen, place the stethoscope head on the left rib cage and shake So listen and ballot, but this time it's a shaking, trying to see if there's any slushing or tinkling or underneath. So they're the 6 steps, always 6 steps of the left abdomen. We now move to the right side of the cow, which is station 3. And many of the observations that were performed on the left side are repeated on the right. First, the superficial lymph nodes, prefemoral lymph node, in front of the femur, below the tubercoxy on the right abdomen, prescapular lymph node, pushing in front of the scapula and letting the lymph node roll underneath your fingers. The right jugular vein, normally collapsed, with the pulse coming about halfway up the neck when the head's in the horizontal position. We then go to auscultation of the heart. We've already measured the heart rate, so no need to do that again. But we still push deep into the axilla, let the cow know we're here again, and push deep into the axilla, underneath the triceps muscle, listening for abnormal sounds and the rhythm. Listen to the lung field. Again, the triangle outlined by the line between the tip of the elbow, behind the triceps, up to the withers, below the vertebrae, straight line back to the second last rib, and a straight line down to the point of the elbow. There's our 3, 2, 1 pattern. Listening carefully at each spot, but particularly ventrally, as she takes breaths, listening for anything abnormal, wheezes or crackles. Then the right abdomen. There were 6 steps to examining the left abdomen, but on the right there's only 5. Look for any distensions, feel, but we don't listen. Auscultation of the right abdomen is quite unrewarding. There's very few gut sounds to be heard. So we don't bother listening or auscultating to the right side. And that reminds us that this is a cow, not a horse, because in horses, of course, it's important to listen to the ileocecal valve on the right. But in cows, we skip that step. We still do the auscultation and percussion over the right rib cage, all over this area here. Stethoscope head on one rib and percussing on the adjacent rib, up and down, making sure we listen ventrally, right over the rib cage and back over the paralumbar fossa. Again, if we hear a ping, we place the stethoscope head and we outline the area of the ping, telling us the size of the gas-filled cap on top of the fluid-filled viscus below. That was auscultation and percussion. Ballotment, with a clenched fist, closed fist, push in and wait for something to bounce back. Sometimes a fetus in a heavily pregnant cow. Then succussion. That's ballotting and listening at the same time. Stethoscope head over the rib cage, ventrally, and shaking the right abdomen. Normally, you don't hear any abnormal sounds, but when there's fluid and gas inside, you might hear tinkling or gurgling. So the 5 steps. Skipping the listening. Look, feel, auscultate and percuss, ballot and auscultate, which is called succussion. But there is one final step on the right side, and that is to feel in behind the right rib cage to see if you can feel anything hard that would be the liver. Now normally you won't feel anything, as in this case, but when the liver's enlarged, you can feel it protruding behind the right rib. The last rib. And that's the right hand side of the cow. Station 4, examination of the head and neck. We look for any swellings in the neck region, particularly in the brisket area, or submandibular swelling, underneath the jaws here. Have a look at the skin of the neck, the jugular pulse again, but the skin of the neck, and check for dehydration by tenting the skin, taking a pinch of skin and turning at right angles and watching how quickly it returns to normal. We then look for the superficial lymph nodes of the head you'll notice that there are 3 of them, but we often can't feel the retropharyngeal unless they're swollen. We also usually can't feel the parotid lymph nodes just below the ear here unless they're swollen, but we usually can feel the submandibular lymph nodes underneath the jaws here. We then check the ears for any abnormalities. Are they drooping? Are there any discharges? We check the symmetry of the head. No differences between left and right. Can the cow see? What's the menace reflex like? Does she blink? And then we want to examine the conjunctiva. So maybe for this cow it would be easier to tie her head up just a little, make it a little easier for us. Pull the head up tight, tie it with a quick release knot, and come back to the eyes. And we want to examine the conjunctiva of the eyes. So the technique for that, if she'll cooperate, is to pull down with one hand the bottom eyelid, place your thumb on the top eyelid towards the margin, take the upper eyelid over the middle of the eye, and then press into the head. Or we could do it with our fingers. Press in. Look for any discharges. This cow's got some lesions around the medial campus of the eye. They're most likely caused by Staphylococcus spread by buffalo fly. No abnormalities in the symmetry of the head. Then the nose, the nares. Any lesions inside? Have a good look. Is there any discharges? Or even place your finger right up and have a feel. Then to examine the mouth. Stand on one side of the cow and place your fingers inside the mouth on the opposite side where there are no teeth, and you can open the jaw. You can pull the bottom lip down, and look at the colour of the gums. Look for any hemorrhages, erosions, vesicles. Have a look at the incisors and count how many permanent incisors there are. This cow's got 8 permanent incisors, telling us that she's a mature cow. Then to examine the tongue, again place your fingers in the side of the mouth, but on the opposite side, take your hand into the side of the mouth, grab hold of the tongue and pull it out firmly. Again, have a good look at the hard palate, the tongue for any lesions, whether there's any softness or hardness to the tongue. And you can even place your hand right inside the mouth and feel the back of the tongue, but remember when you do that, always keep your fingers vertical, away on the inside of the molars, never place them between the molars. And that completes station 4, examination of the head and neck. The final station in the close physical examination is the tail end revisited. Again, just let the cow know that you're there by reaching out in case she's not expecting you. Then you can move closer. The first part is examining the udder. Have a good look at the udder for symmetry and shape, abnormal swellings. Look at the teats for any lesions. And then in dairy cows, it's usually possible to reach down and palpate the udder. Again, that's the best way to feel any abnormalities. You can palpate at times the supramammary lymph nodes, particularly when there's an infection in the udder. Of course, with a beef cow, you might have to take more care. You might have to use a tail jack, like having an assistant push on the tail firmly like that as you reach down and examine the udder. Then we examine the vagina. There are 2 ways to do that. First, with a gloved hand. Secondly, with a metricheck. If water's available, which it often is in a dairy, we can wash the vulva clean with water. And then apply some lubricant, lift the tail carefully and lubricate the vulva, and then push into the vagina. But remembering cows won't always enjoy that, so be careful. Push in, feel the cervix, and then withdraw some discharges and have a look at the colour of the discharges This cow's got very clear discharges. She's calved about 3 weeks. No evidence of infection. We're looking for blood, pus, smell. Another way of examining the vagina is to use a metry check. Take the tail firmly in your left hand, insert the metry check, 45 degrees angles, and then horizontal and push in. Don't delay. It's the early part of pushing that in the cow doesn't like. Scrape a few times along the floor of the vagina, and again, carefully remove and watch for discharges. Again, looking at the colour, mucus, blood, pus. Then we move to the rectal examination. Lubricate the hand, push in, and we're going to feel down. We're going to feel the cervix, the uterine horns, the ovaries. Feel the rumen, the consistency of the rumen. We've noted it as we were feeling through the left abdominal wall, but we can have a good feel of the rumen contents with our left hand once in the rectum. Also the left kidney. We can feel the left kidney. And then to the right, the bladder maybe, if it's distended, and any swellings or distensions of intestines, any adhesions. As you withdraw, we examine the faeces. We look at the colour, the smell, any evidence of blood, how digested the material is, the length of the fibre, dry or wet or soft. Finally, we examine the legs, looking for symmetry, any swellings, any cracks on the hooves and the claws, swellings of the joints, swellings of the legs, and you can reach forward in front and feel the stifles for any evidence of joint swelling, particularly any fluid swelling bulging out between the straight patellar ligaments. And that completes the 5th station, the tail end revisited.